Welcome to the Personality Couch podcast, where we discuss all things personality. I'm your host, Doc Bach, here with my co-host, Doc Fish. We are both licensed clinical psychologists, and today we're starting our series on histrionic personality. Now, histrionic is derived from the term hysteria, which has come to mean many different things. So we need to unpack what hysteria was, how it evolved, and how its horrific and inhumane roots set the stage for the histrionic diagnosis that we know today. Sensitive listeners and viewers, we are going to talk about maltreatment of women in medicine, acknowledging the horrors that led to the study and naming of this condition. And with that, let's talk about hysteria. Hysteria is translated to mean restless uterus or wandering womb. Early philosophers thought that the uterus became displaced and wandered around the body, and the fluids from a male were the only thing that could calm the uterus down, as such fluid had healing power. So women were told to get married and get it on.
All right. Well, that is crazy. So basically, women who were menstruating demonstrated strong emotions, and we now understand this to be hormone related. They did not get that apparently at that time. So they just thought that the uterus up and left and interfered with the brain's logic. So emotionality and libido-related changes were thought to stem from this wandering womb.
And of course, the female anatomy is different from the male's, so it must be the female anatomy that's the problem. So even though history points to similar ailments in Egyptian, Greek, and medieval times, hysteria was first described as a medical condition by French neurologist Jean-Martin Charcot in 1880. His groundbreaking yet highly controversial work set the stage for the field of psychiatry and psychology, which were in their infancy at the time. So much like ancient philosophers, Charcot also thought that hysteria was a uniquely female condition, but one that was caused by an internal injury that directly impacted the central nervous system. But it was still kind of a grab bag of symptoms, often involving physical manifestations like paralysis, tics, pain, loss of sensation in the body, being too sensitive in the body, crying, hiccups, headaches, nosebleeds, mutism, nausea, eating disorders, GI issues, sleep issues, fainting, etc., etc. Basically, anything that didn't fit neatly into a box if you were a woman.
So what was hysteria exactly?
Great question. Basically, hysteria became the catch-all term for the stuff that male doctors and philosophers didn't understand about women, and they used it to dominate and subdue them, especially as the field of medicine and science was nearly 100% male at the time.
Well, that's not helpful. I mean, this still does kind of happen today, though it's not necessarily diagnosed as hysteria. So a female can go to the doctors and provide a list of symptoms and then be dismissed. Like, it's just hormones, you're just too sensitive, drink some water and it'll help.
Yeah.
A male could go to the exact same doctor, exact same symptoms, and actually get a legit treatment plan. So I have seen this happen shadowing providers. I've heard it happen from others. I've experienced it myself. So regardless of whatever position you take on politics, societal norms, gender roles, like whatever, women do have to advocate for themselves more in the medical system.
Absolutely, they do. Yeah, and back in the olden days, women didn't have the voice to advocate for themselves. So physical symptoms was the voice. It was the only means of communication that they had.
Ooh, that is an interesting point because physical symptoms communicated something.
Absolutely.
So any physical symptoms that might be psychological or just any physical symptoms they didn't know what to do with was just hysteria, but only for women. Yeah. What about when men maybe had some of those symptoms?
You think men have these symptoms too? What?
Maybe.
Yes. Yes. Well, then it was just a brain abnormality.
That's too simple. I'm not buying that. Okay. So I do understand that hormones can cause a ton of different symptoms, pains, sleep issues, stomach issues, headaches, etc. But that is not only what we're talking about here. Like, it's not just PMS. These symptoms were life-interfering, disruptive to the self, others, and society, supposedly.
Yeah, supposedly. And let us not forget the time period in which this was all happening. So in the 1880s, and even prior to, women globally were seen as inferior to men. Psychology was not quite its own field yet, really. And we didn't talk about trauma or how things made us feel. We didn't talk about anxiety or depression or repression or suppression or oppression of gender roles in society. So all this stuff came out in somatic symptoms, bodily aches, pains, and conditions, especially for females living in a patriarchal society where they had no power. And to make matters worse, in many places around the world, anyone could be hospitalized for any reason at that time. Like a woman potentially could be locked away for stepping out of her social bounds, for being promiscuous, for having a fit during her period. Any misfits could just be locked away. I mean, I think I would start having abnormal physical symptoms too if that happened to me.
Yeah, definitely. It makes me think of Pirates of the Caribbean, like the corset when she passed out. Like it literally makes me think about corsets. We are constraining the emotional breadth and desires of women. So emotions were rejected and there were consequences for even having the emotions, like maybe being locked up. And I'm sure that didn't help anxiety or the emotions. So like, where did they go? Where did all those emotions go if they can't be expressed in the body? It's a physical representation of a constricted society.
It absolutely is. Yeah, the corsets represent the constriction of the times. Women had to be put in their place, even in their manner of dress. Okay, but we do need to move back to Charcot. So neurologist Dr. Charcot in the 1880s conducted a lot of his studies on hysteria at the Salpetriere hospital in France, where he used his so-called Museum of Living Pathology to work out his theories and healing powers. Charcot's treatment of hysterical patients often included hypnosis, which was highly criticized as being staged and 100% theatrical. Now, he also used physical violence to a woman's abdomen, a mechanical ovarian compressor, electric shocks, magnets, and even something called dermagraphism, or where they would write obscenities on the patient's body, believing it would like hold on to them like a magic slate and perhaps even draw the pathology out. So telepathy and clairvoyant stuff was also not out of the question. And of course, let us not forget, drugs, burning, cauterizing of organs were also used, sometimes for treatment and sometimes for discipline and control. There were horrible, unimaginable things done to females in the female anatomy in the name of hysteria.
Mm-hmm. Now, can we just go back to the Museum of Living Pathology for a second?
Right?
It reminds me of like Barnum's Circus, like an exhibitionistic display of Charcot's powers.
Yes.
And so maybe he was swept up in that attention seeking, but he used it in a sadistic, narcissistic manner, which is so gross and incomprehensible.
Absolutely. Well, I mean, some called him a showman instead of a physician.
Oh, wow.
And to that point, sometimes these attacks were even induced through this awful treatment if the female patients were not performing to his liking. Basically, they were forced to remain sick so that Charcot could show his great powers to an ever-eager audience who watched his treatments live and in person. Like, think of like the Dr. Phil show gone way bad, like live in person. It wouldn't have been televised at the time, but like, come and see me do these miraculous things. Like, and of course, Charcot got a lot of fame and fancy kickbacks from the elite for his work here, making a freak show of these individuals experiencing psychological and medical events.
They couldn't even leave, though. He was treating them and he was apparently so powerful, but they couldn't heal because they had to remain his monkeys in his circus.
Absolutely.
Ugh. I can't help but wonder what his relationship with his mom was like, but...
Who isn't wondering that, right? Yeah. And Charcot wasn't just some guy in some book. Like, he literally set the stage for the field of psychology and psychiatry. And this was one of his major stepping stones to get there. Like, his work on hysteria is a building block for our field, for better or for worse.
Yes. Yikes. Ugh.
Yeah. But it's also important to note that Charcot taught his medical students at these live events too, at the Salpetriere. So one of his students was none other than, can you guess? Sigmund Freud. So yes, if you're following along, Freud was actually a neurologist, not a psychologist, because psychology wasn't really quite a separate field yet. So Freud also saw a pathway to fame, writing on Charcot's coattails, and continued his studies on hysteria from 1880 to 1915, thinking that he too could make a name for himself, since hysteria as a study and as a freak show, was gaining traction in society. Now, Freud, to his credit, actually believed that hysteria was not due to a physical injury like his teacher Charcot did, but instead it was due to psychological trauma. Yes, Freud, we got something right. But then this is where it gets lost. So Freud's take on female trauma was basically the Oedipus complex. In other words, if you're not familiar, the source of a woman's problems was being born without male anatomy.
That's rude. Yep.
Like, seriously, not the fact that men were abusing these women in a patriarchal system where they had no power, but that they had inferior anatomy and were jealous, which is unbelievable.
Freud. Oh, Freud. I would expect nothing less than his mommy issues to show up here. But
not him too.
Anyway, yeah. So later theorists added hysteria could be found in some men who suffered from castration anxiety, or it was just chalked up to brain abnormality. And some men were also subjected to horrible treatments in the groin area, which is not okay.
Yeah.
Women were the majority of these patients. Now, also outside the hospital setting at the time, hysterical women went to the doctors and were basically thrown out as fakers. So we do have to give Freud credit here because he did at least believe these women and start asking questions like, how can you know something but not know something simultaneously? Or can the body actually express things that are too much for the mind to handle? Questions like these shaped psychoanalytic theory, which is awesome. And so maybe his answer to the questions didn't hit the mark, but the questions themselves, I think, are extremely important.
Yeah, I have to agree. He had a lot of really profound ideas and he was asking really good questions and he listened, which is great. But also the other side of that is that his ego and his coke addiction also clouded a lot of his work. So it's both.
Yeah. That's so true. Also, random fact, Freud regarded himself as somewhat hysterical, and one of his earliest publications was Hysteria in a Man, which is fascinating because men were not typically viewed as hysterical at this time.
You know what? I actually read about that too. In the book, Freud, The Making of an Illusion, he would write to his bride-to-be and complain of all kinds of neurotic anxieties and physical ailments like insomnia, indigestion, severe headaches, nasal mucus, sciatica, rheumatic pains, and constriction of the throat. So these are the very things that someone with hysteria would experience, which is maybe why he at least listened to the women and analyzed them regardless of his motives.
Okay. It makes me wonder if he was maybe trying to get motherly care from his fiance, like playing into his attraction to his mom. Or it could also just be a parallel process. So like working with sick patients and then now we're like sick all the time. Yeah. Maybe even a narcissistic competition to see how he could get more nourishment than his patients.
Oh, that's interesting.
So that it is just fascinating, but he wasn't subjected to an actual diagnosis of hysteria and he wasn't treated with electric shocks or invasive procedures.
Exactly. Yes. We're being a little hard on Freud, but also he had some blind spots. But also, just like everyone else in history, Freud recommended the cure for hysteria was to become one with a man, to get married, to be intimate, and your problems are solved. So the woman gains male anatomy through marriage and perhaps even gives birth to a male with male anatomy. Can you hear my eyes rolling on mic? Is that coming through? Because they are.
Yes. I read too that early marriage and frequent pregnancies were also encouraged as treatment. So which zooming out, they're just prescribing different hormone balances, like get pregnant, get rid of menstruation, ride the pregnancy hormones. And that's also a very male way of looking at that issue.
Yeah. And also it's get back in your societal place, woman. So we can see that the history of hysteria is absolutely deplorable. It's inhumane. It's unthinkable. And it was misogynistic medicine used to subjugate and humiliate women so that male physicians could make their name in society, which is despicable.
Mm-hmm. Yeah. And we are being very soft, actually, in describing the things that happened. This is all very important to discuss because this is a foundational aspect of the development of psychology and psychiatry, as well as the eventual understanding of histrionic personality disorder.
Yeah, absolutely. And I think we need to zoom out again, societal context. Like, I think of how women globally were regarded as inferior in this time period. They had no power. And sometimes that was even written into law, as I believe it was in France at the time. And they were often subjected to abuse at the societal level and at home too. And then that trauma is recreated at these awful institutions like the Salpetriere. And of course, symptoms are going to show up, right? With those layers and layers and layers of trauma. And if there were medical things going on too, like neurological conditions, autoimmune things, the societal factors are only going to make this worse. And there's no place for the trauma symptoms to go but out through the body, because there's literally no other path for them in these times.
Exactly. It's that constrained society where emotions are to be shaped into something sophisticatedly beautiful, like a tightly buttoned up corset that moves organs and leads to passing out. So
Yeah.
can you imagine though, like picking up a lady who can't breathe in her corset and putting her in the hospital, undergoing treatment after treatment after treatment, but never even considering unbuttoning the corset?
That's a perfect metaphor for hysteria, actually. But you know what's interesting is that while hysteria was all the rage in the 1800s, even though there's evidence of it before that, like it really kind of came to a boiling point in the 1800s with it starting as a medical condition under Charcot. But the diagnosis really kind of went away not too long after that. And in 1908, Charcot's colleague, Babinski, wanted to get rid of hysteria altogether. And at a board meeting for bigwig neurologists, other voices were quick to follow. Basically, what Charcot spent over 2 decades building was dismantled, thrown out, and discredited in a matter of 2 days at this board meeting by some of the biggest names in neurology. Isn't that wild? And then, especially fast forward a few years, World War I started, 1914. Hysteria became a thing of the past in Europe and North America.
Okay, so do you think then social factors of the war had an impact on hysteria?
That is such a great question. One hypothesis I have is that we had to take a different look at gender roles. Like women couldn't just take the traditional role anymore. I mean, heck, neither could men, right? It was roll up your sleeves, get to work outside the home to support the global war efforts, to save lives, to bring our men and women home, because women were also serving in the armed forces. So we couldn't just blame everything on sexuality anymore and fixed gender roles. And also the elixir to hysteria was out of play too, because there was way less intimacy during war times, obviously, right? But anyway, it forced us to look at things through a different lens.
Yeah, and I imagine that advances in medicine and science also debunked some of the initial theories about hysteria.
Sure.
As we learned more about the body and the brain, we now had reasons for some of the vague hysterical reactions, like the study of reflexes, leading to understanding organic paralysis. Neuroscience helped us understand syphilis and epilepsy. Each took one more thing out of the hysteria bucket.
Absolutely. Yeah, the catch-all that it had become. But then somehow hysteria popped back up again after it had been forgotten. So researcher Paulone noted, curiously, it was long after the phenomenon had already vanished in European medicine that U.S. psychiatry went back to recover it, furthermore placing it in a tool which would quickly become an international reference for the diagnosis of mental disorders by physicians on a global scale.
You are talking about the DSM, aren't you?
Bingo. Yeah. So Americans decided to pick up hysteria once again and put it in the first edition of the DSM in 1952. And honestly, remnants of it have remained in the DSM ever since, even if under different names. But now we have to remember that the DSM in 1952 was first created as a response to those coming back from World War II, because we had to have a unified way to treat our servicemen and women. So we created this book of disorders. So now, as to why hysteria made an unwelcome comeback is up for discussion.
Was it only white dudes on the DSM-1 task force?
Probably. I honestly have not been able to find a good reason why it came back after 40 years. So if our listeners or viewers have any insight on that, I am all ears. Let me know in the comments.
Definitely. Well, what we do know is that hysteria started as a medical disorder in 1880. But as we fast forward through the decades, there's a social and scientific evolution of hysteria to histrionic, And that parallels the movement from medical to psychological disorder. Also, though, because it was such a catch-all term, it ended up in a lot of different places in the DSM. So let's briefly walk through the important ones.
Yeah. So for being the wandering womb diagnosis, it certainly wandered around the DSM and found its way into many different sections with different meanings. So the DSM I listed hysteria as physical or neurological symptoms without a medical basis. So this is probably going to be similar to some of the things that were seen at the Salpetriere hospital. But then the DSM II in 1968 took it a step further. We described hysteria as two things: neurosis, meaning anxiety-driven, and as a personality.
Okay, so hysterical neurosis in the DSM-II was an anxiety about physical symptoms that did not have a known cause. There were actually two types of hysterical neurosis. So the first was the conversion type, and that could be things involving motor or sensory issues. So it might be blindness, deafness, loss of voice, not being able to feel a hand or a foot, paralysis, problems with balance or gait, a lump in your throat, difficulty swallowing, even seizures with no medical basis. So we now call these psychogenic non-epileptic seizures, in which there's no abnormal brain activity, but still actual seizure symptoms.
Wow. Yeah.
And we still recognize conversion symptoms in the DSM, except it's just now called functional neurological symptom disorder.
Yes, so the name changed. Yeah. But the second type of hysterical neurosis here in this version of the DSM was dissociative. So this type of hysteria involves dissociative amnesia, or forgetting information about yourself, especially traumatic information, or maybe being in a dissociative trance, which involves an altered state of consciousness, like even fainting, among other things. So here, without saying it overtly, psychology is starting to recognize that there is some type of trauma involved in hysteria, leading to unexplained physical symptoms, forgetting, and altered states of consciousness.
Yes, and in the DSM-II, we also have the addition of the hysterical personality, which is going to be the topic for this series.
Yeah.
And the DSM-II description reads, these behavior patterns are characterized by excitability, emotional instability, overreactivity, and self-dramatization. The self-dramatization is always attention-seeking and often seductive, whether or not the patient is aware of its purpose. These personalities are also immature, self-centered, often vain, and usually dependent on others. This disorder must be differentiated from hysterical neurosis, which is a thing we just talked about, like anxiety about all the unexplained physical symptoms.
Right. Yeah. So now we're separating the character from the symptoms. So the character is more the attention seeking, which is interesting because that was almost Charcot. As I'm thinking about this. But anyway, the attention seeking piece, not necessarily just the unexplained physical symptoms, but hysterical symptoms cause anxiety and often do involve some of those unusual neurological physical symptoms. But a hysterical or histrionic character is that personality that thrives on attention from others and is seductive. So asterisk, we also brought back in sexuality to be in line with hysteria and made it a personality disorder.
Right. Go figure that the attention-seeking personality was put on display in attention-seeking behaviors.
Yeah.
Histrionic personalities don't necessarily have to exhibit overt hysteria symptoms. They are separate. So hysterical symptoms may be ego dystonic, meaning it's distressing and unacceptable to the person, while the histrionic personality symptoms become intertwined with who one is, being ego syntonic or acceptable to the person.
Exactly. But fast forward to more recent editions of the DSM, where hysteria rebranded yet again under three main categories of somatization disorders, or bodily disorders, physical and neurological symptoms, like we just talked about. Number two, dissociative disorders, again, affecting consciousness and memory. And then we have both histrionic and, I would also argue, borderline personality disorders fit here.
Oh man. Okay. So there can be a strong overlap between borderline and histrionic, maybe even being the same at times. And I'll have to go deeper into that thought in a different episode though.
Yes.
Spoiler alert, maybe borderline versus histrionic episode.
We'll go there. That's going to happen. It needs to. I have thoughts too. Anyway, with all this rich and terrible history in mind, as we set up the series to talk about histrionic personality, I want to hear more of your unfiltered opinions, Stockfish, because I know that you have them.
Oh boy. Okay. Where to start? Let's see. The personality disorder in particular has a fascinating history, and it's very important to understand the social influences when it was put into the medical nosology. It's probably even extra important to understand because this is an extroverted, other-oriented personality that reacts to others, and others make up society.
Yeah, I agree. So what you're saying is sociology has a big piece to this as well, like sociocultural, sociopolitical factors. In other words, personality dysfunction doesn't just happen in a vacuum.
Exactly. Now, I do wonder if we have a masculine personality counterpart, not necessarily as abused and treated badly as hysterical women, but what about antisocial personality disorder for men? So bear with me.
Yeah.
They are taught they can't be weak, they can't cry, they can't have emotions. And so then they're impulsive, action-oriented, and angry. And maybe, I don't know, I suppose it's not helpful for emotion to be suppressed. Surprise.
Right. The minute that you said masculine counterpart, I knew where you were going. Yeah. But that's an interesting concept because both are in the cluster B personality category. So they're going to have more of this extroverted, dramatic, erratic nature. And on that note, both histrionic and antisocial take an active approach to their internal distress. It's not passive. It's out there in your face. Like, see me, respond to me. Like, what if? Just a hypothesis. Any chance that Charcot was an antisocial treating histrionic-oriented women in his hospital?
Ooh, I mean, maybe. I do think he at least has some sadistic aspects to him as well. And it also makes me wonder if histrionic mothers maybe are more likely to have antisocial sons and vice versa, similar to the generational patterns of narcissistic and borderline.
Yeah.
And of course, I can't help wonder if Charcot was treating women the way he was because of his own mother. I have no data, though, to back that up. It's just a curious thought.
Yeah, just curiosity, because those attachment patterns follow us. But the cluster Bs do cluster, going back to that. So narcissists and borderlines dance together, and histrionics and antisocials dance, but more like a burning house because both are activated and reactive in masculine and feminine ways.
Oh, yeah, like gas and fire. Now, also, what if Freud thought he had hysterical traits because he wanted Charcot's attention? So I don't know. There are so many possibilities with all of these interactional dynamics.
Oh, what a thought. For real. I actually think Freud had more vulnerable narcissism traits from what I've read, like this, woe is me, the world has yet to recognize my greatness. Pay attention to me, Martha. I have lots of mucus. It's like what he would write to his bride-to-be, you know? So he needed to ride the wave of a stronger energy to make his claim to fame. And Charcot was just the ticket. And it also makes me think back to a few things that I've read. So the accounts of Freud and Charcot, I will say, are not all in agreement. So some accounts say that both Charcot and Freud saw hysteria as a female reaction to the patriarchal system, but both refused to acknowledge it and instead advanced their own theories. Anyway, that's just one possibility that I've also read. But one thing that I have seen about Freud, though, is that in Vienna, as he uncovered more patterns through psychoanalysis, he really started to see the abusive male power that made these females symptomatic. But one hypothesis is that he may have received a lot of pressure from said influential males in society to keep his mouth shut, lest the intimate details of problems in the home be revealed.
That is so fascinating. So maybe that's why he complained about like the constriction in his throat or that lump in his throat. Like it was stuck. He had something to share maybe, perhaps, but he couldn't. And on that psychoanalytic note, I'm super excited to get into the origins and internal workings of histrionic personality. Yeah. I think that Freud did start asking the right questions, and I do think this personality likely has some very deep psychoanalytic roots that we can explore.
Absolutely, which is why we plan to unpack also the histrionic schizoid romance in this series. So make sure you hit that bell and subscribe. You don't want to miss Yes, that one.
Yes, because in regard to opposites, histrionic and schizoid are very opposite in a variety of ways.
Yes, but they do tend to attract one another for reasons we will discuss later.
Okay.
So we do hope you'll tune in for the rest of the series. We've got a lot in store for you. So don't forget to like and subscribe. It does really help out our channel. And lastly, if you're a personality nerd like us, we've got blogs, visuals, and references that coincide with each episode at www.personalitycouch.com. Be well, be kind, and we'll see you next time on The Personality Couch. This podcast is for informational purposes only and does not constitute a professional relationship. If you're in need of professional help, please seek out appropriate resources in your area. Information about clinical trends or diagnoses are discussed in broad and universal terms and do not refer to any specific person or case.